Okay, so hello guys, this is me, Danish. Nice to meet you. It's been a very long time, and so we've got a little different kind of a setup here. My camera is like a bit, below. So hi there. I'm using my cell phone as my video recording device. So this video is like a culmination of a lot of years of work. I'm gonna hold the mic a bit closer to my mouth because sometimes the voice is not clear. And what I'm basically trying to do in this with this video is to give you like an overview of all the things that I've learned during my last couple of years of preparation for the competitive exams that I appeared in, right? And it's like 3 in the morning, so if I make any mistakes, please forgive me. But this video, according to me, is the best of what I know about competitive exams, and I think anyone who watches this video is going to benefit from it immediately and immensely. Hopefully, if they don't know anything, that is. If you know some of this stuff, it's cool, but even then, a revision is always a good idea. So let's start. Who am I am Dr. Danish. I am an MBBS graduate. I studied at Osherot National University, and I'm done with my FMG. FMG is basically, for those who don't know, an exam in India. It stands for Foreign Medical Graduate Exam. Basically, you need to get this thing done before you can practice as a doctor, and I'm done with that. And I'm currently preparing for MRCP. MRCP is Medical Royal College of Physicians. It's an organization in the UK which allows you to specialize in internal medicine. So I'm not a topper, I'm not a coach, but this is going to be more or less, like the advice that I would give to anyone who would ask me, how I was able to get through my entire journey. So number one, why am I making this video? This cool art that you see here, this was auto generated. I think I have no role in placing it here. So the reason I'm sorry, why am I making this video? The reason that I'm making this video is because a lot of times what happens is that the advice that we are given, it's like a lot of times conflicting. One person says one thing, the other person says another thing, and in the lieu of that, it is almost always like problematic that people like end up like valuing things which are not so important, and maybe let go of things which are actually important. Repeated failures. I had tried a lot of these advices, and a lot of times some advices worked, some did not work. But then again, when something new comes up, and then you're like, oh, let me try this new thing, and then you try to do that, and then that fails. Like that has happened with me a lot of times. And then I realized that as a human I am, and I hope you're a human as well. We make a lot of mistakes, and by mistakes I mean doing the same thing over and over again and expecting different results. Then I have not seen a proper clear framework out there for something like this, so this is my attempt to make sense of this entire thing. That is why I'm making this video. So who is this video for? This is primarily for people, I mean, this includes all the categories, but this is primarily for people who are starting their preparation now. This is for people who are just starting to prepare for an exam. I wish that someone had showed me this video, and I'm not saying that because I am the one who's making this video, and I'll benefit from this. And I know you can't see my face, but it's more important that you hear my voice. And I'm but this video, I think is really clear and clever in a way where well, you'll get to see it. Let's not talk more about the video, let's talk what is in the video. This video is also for repeaters, people who have written an exam, didn't get through, and are preparing again, people who are burned out, people who are confused, right? So what is this video? This video is not a course, not an affiliate thing, not a miracle strategy, no motivation. I'm not going to motivate you. I'm not going to give you like a strategy which is like going to get you the best score out of everyone else. That is not what this is. This is primarily going to be what methods, what techniques are out there, and out of them, what are the most high yield ones, what are the common mistakes that people make, and how do we make sure that we don't end up making the same mistakes over and over again. So number one, this is like one of the most important things that one must understand, right? What are competitive MCQ based exams actually testing? I believe if you don't know what they're actually testing, right, it would be very difficult for you to get into the mindset of the person who's preparing the exam and solve it, right? Because you are on the other end, as a student trying to appear in this exam and get a good score, get a passing score, at passing grade at a minimum, and get through it. But the person who has to prepare this exam, what is that person thinking? What do they want from you? So what students assume is this is a test of knowledge, of hard work, of syllabus completion, and of memory of facts. As you might understand, this is an assumption that people have, but how true is this assumption? How good is this assumption? These assumptions make sense because for example, this is like take my history. I've been to medical school, right? In medical school, what we are taught to do is we are taught to know everything from the top to the bottom, in a way where you're supposed to be able to go into the depths of a topic and understand it completely as much as you can. And because a lot of the exams that we give are theory based exams, and there the answers can be long, can be elaborative, can be descriptive, and there the effort is rewarded, right? I remember a lot of the times, even if I did not particularly prepare well on some of the topics. If I prepared well on some other topics, the examiners saw that. They were like, okay, this guy has put in some effort, let us give him a pass. That cannot happen. That doesn't happen in MCQs. That doesn't happen in competitive exams. So the thing is, if knowledge alone was tested, pass rates wouldn't be 20 to 30%. The exam that I told you about, FMG, on average, the pass rate for FMG, for a medical graduate exam, is like 20 to 30%. That is when, and the time that I wrote the exam, the pass rate was 10%. To give you an understanding of what this is, imagine that when I went to the exam center, when I was in the exam hall, there were 9 other people around me, and those 9 people did not pass. I was the only one who passed through the exam. Now, did those 9 people did not prepare? Absolutely not. They might have done their best. They might have a lot of understanding and knowledge about what was going to be tested on. But knowledge alone isn't enough. And if knowledge was tested, passing rates wouldn't be so low. So, to understand what is exactly tested, we need to understand this for a while from the examiner's point of view. We have to have a little sympathy. Because we need to have a little empathy. Sympathy, obviously not. You're not preparing an exam yourself. I hope not. You're preparing for the exam, but you're not going to prepare an exam paper. So let's have some empathy. What is the examiner actually asking, right? The problem with examiner is that the examiner has to at one time examine lakhs of students. Lakh is like an Indian currency denomination, which is like 100,000. So an examiner has to basically test more than like hundreds and thousands of students at once, right? In some cases, at once. The time that they get is very limited. They need to have an objective marking scale, because you can't judge someone on the basis of how good their handwriting is, or how polite they are, or how nice they are, right? I mean, those things do matter, but for the sake of our exam, the examiner cannot do that. He or she or they, unfortunately, are not in a position, so there cannot be any subjectivity. So they have to be very, very objective. Now we get to why MCQs exist. MCQs exists because of the following factors, and this is from the examiner's POV. Standardization. Imagine that the exam that you're writing only happens in your school or in your college, right? Then it can be more difficult than if it were to happen in your state or country, because your professor could put up any sort of questions, right, which are of course in the syllabus. But if you have to examine like hundreds and thousands of students, you need to have a standard. You need to have a standardized method of testing, and that method should come from a standardized syllabus that you provide the students with, so that they can prepare, so that it is fair, right? Scalability. The thing about scalability is that there is, as I said, limited amount of time, so you cannot prepare thousands and thousands of questions for every student, right? You can only set up certain amount of questions, because it takes a lot of effort and energy, and the questions have to be fair, and all of this ordeal has to happen in a day or two. For most exams, right, in a day or two, they have to get through the exam, test the candidate, give out the results, and send them their merry way. Now, what the examiners cannot test, they cannot test your depth of understanding, Imagine that there is just one line that you remember from an MCQ you did like 5 years ago. You remember just that one line from a topic. You go in and you write that MCQ, like a similar MCQ comes up, and you select the correct option and you go away. And on the same hand, there is this other guy who has taken a lot of his time and researched this topic. Maybe he has studied for it from 2-3 standard references. He has studied it from using AI, like, and all this bullshit, right? He has done everything that is imaginable, but he doesn't know this one fact. He's not going to pass, because examiners here are not testing your depth of understanding. Examiners cannot test your clinical judgment in real time. As I said, like, this applies to medicine and other fields as well, but it is very, very difficult to judge clinical judgment, like clinical skills on an exam, on a piece of paper. They can't, as I said, like others, as we were talking about other things, they can't test your empathy, and they can't test your bedside manners, right? They can't test how nice or how rude you're going to be to the patient, right? So these things, what I want you to know is that they are important in real life, but for the purpose and for our sanity and for passing this exam, please don't think that you need any of these. The reason that I'm telling you this is because I need you to focus on the things which matter the most. After you're done with the things which matter the most, we can get to the depth of understanding. We can think about clinical judgment in real life. We can think about how to have empathy with the patients. No one is going to a doctor who has not passed their licensure exam. So what can they test? What can the examiners test? The examiners can test recall. What is recall? I tell you a fact, and a couple of days later I ask you to repeat that fact to me, so you have to recall it from your memory. That is recall. The reason I'm explaining this is because a few days back I had like another person that I was explaining this to, and they were like, Danish, what does recall mean? And I had to explain it to them. Pattern recognition. Pattern recognition is, you see things that you have seen before, and you see similarity between things and you recognize a pattern. Discrimination between options, that is, you have 4 or 5 options in some instances, and you have to pick the best option out of them, by making sure that you don't choose the wrong option. Well, and you'll be like, that is not like the cleverest thing you have said all day, and you're right, but we have to be very how do I say this, specific about this. We have to be very verbal about this, because once we start to take things in a way which goes into our unconscious, right, it gets difficult. So discrimination between options and consistency, that are you able to consistently do all of these 3 things, recall, pattern recognition, discrimination between options, for like a majority of the questions that are in the paper. Now, what is the real skill? The real skill under the hood is, this is supposed to be a logo for Mercedes, I think. Mercedes, I think is that look. I don't know, guys. It's very late at night. But sorry. Let's get back to the topic. The real skill under the hood is speed plus accuracy under uncertainty with incomplete information. What this means is, you'll have a question that you've never seen in your life before. You need to do it with speed, in a limited amount of time, with accuracy, that is according to the best of your abilities, under uncertainty, that is, you have never seen this question, you don't know what the answer is going to be, and in a lot of exams, we'll never get to know the correct answer, because people, like exam boards, don't publish their question banks outside, and that too with incomplete information. That's the thing, right? For example, a lot of conditions, if a lot of cases that you will see on a question paper, right, if they happen in real life, you will have a lot of help around. You could Google things, you could ask your senior, you could order some test, you could order like some other stuff, but here you have incomplete information. So you need to have 3 things: speed, accuracy, wait a second, speed plus accuracy under uncertainty with incomplete information. Now, there are 2 things that are difficult for a lot of people to understand, but it's very important to have the differentiation between them: knowing versus retrieval. So what is knowing? Knowing is, I know this, I've seen this one, I know this person, this person is familiar to me. So imagine that you open your book up and you see a beautiful diagram, and you're like, oh, this looks so nice, and that there is a diagram on this page. You have a familiarity with this, and you are able to recognize this. Retrieving, on the other hand, is active recall. That is, I ask you, for example, what are these certain parts labeled on this diagram? Many times what happens is that you are familiar, you're like, I remember that in the textbook on so and so page the diagram was there, but you're not able to recall the thing. So retrieval is active recall, that you're able to recall the fact that that this information is connected to this other information in a certain way. Retrieval is selection, that given a certain amount of options, you are able to select the best possible option. And retrieval is also elimination, so you need to know what is the answer, and you also need to know what is not the answer. So even with this, you might think life is easy, but no. Our poor dear examiner has to have something that makes the exams fun, that is traps. So why do these traps exist? The traps exist, this is according to the examiner's logic, is to have a differentiation in rank, to have guest penalization, to have superficial learners exposed. Because so what this basically means is that the examiner knows that a lot of the times like they repeat topics from the previous papers and stuff, and if someone just had like a basic understanding, they could go in and they could they could just read through things and get a good score. But if everyone gets a good score, that's going to be a drain on the system, because the system is only capable of handling certain amount of students going through the pass route. Some people have to fail, so that's why traps exist. And traps aren't evil, they are filters. Why do we have filters? Well, that's a philosophical conversation for another time. I cannot we cannot indulge in that, we have a long way to go.